Hello friends, I am Dr. Vijay Rao, consultant rheumatologist at Divisha Arthritis and Medical Center, Bengaluru. Today we will talk about a very rare but quite disfiguring autoimmune disease called Scleroderma. Sclero means thick, derma means skin. So in simple terms, the skin goes thick. So let me tell you what this is. Our skin has normally 7 layers. The top few layers are called epidermis and the bottom last few layers are dermis. To stick all these layers, the nature has made a gum called collagen. Normally, the collagen in adequate amounts, skin doesn't remain over elastic or over thick. But in scleroderma, what happens due to an immune system defect, the immune system produces antibodies called anti-nuclear antibodies or centromere antibodies or topoisomerase antibodies or SCL70 antibodies. And these antibodies start making excessive collagen or adhesive tissue and the skin goes tight or shrunken. And that is why these patients start having initial days swollen fingers called doughy skin. If you feel the dough, you will feel that when you hold the patient's hand. And over the time, the swollen fingers or the swollen hands up till the elbows or up till the knees, starting from the feet, that is called limited cutaneous sclerosis. In the first 6 months or even less than that is the reversible phase when the skin becomes swollen or what we call as puffy is the right word. That is the time a rheumatologist can reverse the disease by giving tablets such as DMARDs, methotrexate or mycophenolate in a small dose of steroids as well. Without side effects, these tablets can reverse the skin problem and the thickness is prevented. Once it crosses the 6-month period, the skin thickening or what we call as tethering or adhesion happens, and at that stage patients develop sclerodactyly or sharp pencil shape, very hard skin in the hands up till the elbows or knees. Sometimes in diffuse cutaneous sclerosis, within 6 months the whole body becomes tight and thick. Patients feel that they are going very stiff and tight. So, this is a skin disease due to an immune system disease. There are 3 parts in this. One is inflammation, which I just told you, that is immune cell collection in the skin and also in the lungs causing pneumonitis. Lung says 2 big lungs, and in the each lung there are millions of small small balloons called alveoli. In this disease, the inflammatory cells get accumulated in that small balloons causing alveolitis, where there is heat, pain, swelling, stiffness and fluid accumulation in the lung, and the air cannot go inside when you breathe. And also the gone air cannot exchange between the blood and the air. So oxygen has to go to blood, carbon dioxide from blood has to go back to the lungs and you breathe out. That's called gas exchange. That is impaired because the lung tissue becomes thick, there also collagen becomes thick. So, 2 parts, one internally oxygen goes less and oxygen goes less into blood causing pulmonary hypertension, that is right side of the heart becomes high pressure, thereby causing fluid accumulation in the lungs, breathing difficulty, so on and so forth. So, inflammation, fibrosis, where fibroblast is an immune cell get activators producing more thickness in the skin and the lungs and the joints. And last part is Raynaud's, where the blood vessels in the fingertips, nose tips, feet tips, they all become narrowed and the blood doesn't flow, causing white skin, pale blue skin, painful skin during cold exposure. So, with these diagnosis symptoms, a rheumatologist who is trained in immune system disorders diagnoses this problem and does the ANA test and ANA profile test, where they'll find centromere pattern of ANA immunofluorescence staining, anti-SAL antibodies in the ANA profiler, ANA test, ENA test, extended nuclear antigen test, and through that they start the tablets, and sometimes if the disease is severe, biological agents such as rituximab, which works on the B cells to produce these antibodies, are used, thereby rapid slowing down of the disease. Friends, a rheumatologist seeing this patient within first 6 months of disease can be life saving and most important body saving for these patients. If you diagnose and treat this disease within 6 months of your diagnosis, you will retain your body shape. Otherwise, what your body shape is totally changes. Your face becomes shrunken, mouth becomes shrunken, nose becomes shrunken, and the entire body becomes shrunken. Excessive fatigue, breathing difficulty, cough, and all happens. So, We do CT scan, we do lung function tests, we do echo or heart test to diagnose all these. But right treatment, low fat, low sugar, no red meat diet, physical exercises such as walking, physiotherapy exercises, mobility exercises, and keeping up your energy levels and positive mental attitude can make you fight this disease in a better way. I hope this was useful. Thank you very much. Best wishes.